Hi everyone, and welcome to The Small Project, the podcast of the School of Dentistry, IMU. Thank you for joining us today. This section of The Small Project is called The Dental Bites. Tune in to this section for bite-sized learning on the go. So let's begin. Hi, I'm Shahed, your host for today's episode with Dr. Umer Daoud, who is the head of the Restorative Division in IMU School of Dentistry. His core specialty is restorative and biomaterial sciences, and he's here with us today to talk about the most core aspects of restorative dentistry, which is dentin enamel bonding in light of universal adhesive systems. So, Dr. Umer, how important is it for an undergraduate to know about dental bonding?
Well, it is, in my opinion, very, very important because that's, like you mentioned, that's the core of restorative dental sciences, right? Secondly, the success of posterior composite restorations, as like with any restorative material, it relies very heavily on the knowledge and skills of the operator. And it is imperative that the dental undergraduates, they gain this necessary knowledge and skills during their undergraduate dental school program through didactic teaching and clinical practice. So dental school curricula are often really criticized by dental practitioners for lagging behind contemporary and anticipated developments in dental practice. So given the substantial evidence of the routine use of posterior composite restorations, I think dental schools should ensure that the future graduates gain more competencies and confidence in the use of composite restorations, in the restoration of anterior and posterior teeth, and of course in the light of the different bonding systems that we have.
So what are the complications of bonding and what do we expect?
All right, okay, so that's another very important question to address, and because dental bonding comes with a lot of complications of its own, and therefore there are many downfalls to it. So like for example, dental bonding is not stain resistant, right? So they do resist stains, but not as well as the dental crowns that we do. So there's a problem for the material getting chipped or broken off from the tooth. And then there's the composite resin material will need to be replaced occasionally throughout the future. So depending on how often you must replace your bonding, it may be best for you to sometimes choose porcelain veneers to begin with. And although a larger investment, veneers don't need to be replaced nearly as often. So composite bonding or bonding traditionally has the problem. So speaking about lower durability is the lower strength of the material compared to that of ceramics such as Emax and zirconia. While we offer a 5-year warranty on ceramic veneers and a 10-year warranty on crowns, composite bonding comes with only 1-year warranty because it is simply impossible to predict if and when the material can crack, as this is dependent on patients' dietary habits. So eating hard foods such as nuts or sweets and toffees greatly, they increase the chance of bonding to get cracked or breaking altogether. So this is also why composite bonding is contraindicated for patients who clench their jaws or grind their teeth. So yes, there are many external physical complications with the bonding, and of course it comes with problems of its own when it comes to adhesion on the tooth structure.
So doctor, what is your perspective on universal bonding systems?
All right, thank you for that question. So the perspective is very positive regarding the universal bonding system because it's not moisture sensitive, so you can use on wet, dry or moist tooth structure, all of them, because it's bonding to all the substrates. And you can use with all direct and indirect restorations, which are like probably more than 10 micron thickness. And it has an ideal chemical balance for both the total etch and self-etch adhesion, which is like from one bottle as we talk about it. And it's very compatible with all resin cements. There's no additional activator required. So virtually you also see no post-operative sensitivity. And obviously this comes with a huge clinical significance because universal adhesives, they offer the flexibility for total self-etch and selective etch procedures. So you can use it in either way. And it's very compatible with all light, self and dual coat cured resin composite and cement materials for all direct and indirect procedures. And other than the single bottle adhesives may need more than one bottle for indirect restorations, but with universal, like I mentioned, there's no activator. So it's pretty much positive as far as this perspective is concerned.
Can you comment on the bond strength of universal bonding systems? What is the evidence?
Yes, of course. So talking about evidence, to begin with, Wellington et al. In 2015, they published a systematic review in Journal of Dentistry. They stated with evidence that the enamel bond strength of universal adhesives is improved with prior phosphoric acid etching, right? So they're using the universal adhesive system with acid etching done before. So however, this effect was not evident for dentin with the use of those mild universal adhesives with etch and rinse strategy. But selective enamel etching prior to the application of the mild universal adhesive is an advisable strategy for optimizing the bonding, and that's what the evidence suggests. So universal was the only universal adhesive that demonstrated an improvement in the bond strength with the etch and rinse technique also, probably due to its ultra mild acidity, which was not able to rightly condition and prime the dentin substrate. So the systematic review, it demonstrated that prior acid etching did not influence the dentin bond strength for universal adhesive. So that's another systematic review we are talking about. So there has been a lot of differing points between different sort of evidences, and they're talking about the strength of universal adhesive system. Some say that the strength has improved to prior acid etching. Some say that there has not been a substantial improvement, but there's another systematic review in 2022 by Konstantinonis. They suggested that the universal adhesive used in the self-etch mode induced none to minimal changes within the dentin collagen structure. So there was no observed adverse effect on the dentin collagen structure, which was presumed again to improve the universal adhesive bond strength. So overall, the evidence does indicate that the bond strength tends to get improved after we use the universal adhesive bonding system.
So what primarily is the issue of using universal adhesives in the self-etch mode?
All right. So again, that's a very relevant question. Universal adhesives in the self-etch mode. So for self-etch adhesives, a disadvantage of the self-etch protocol is actually the reduction in enamel bonding efficacy, which was also observed with the universal adhesives when we are talking about the use of universal adhesives as a self-etch mode. But one of the problems of self-etching adhesives is that the increase in the surface area of the intact and ground enamel is lower than what is achieved with phosphoric acid. So this effect is also dependent on the pH of the adhesive. So the use of prior acid etching increases that enamel bond strength, as we've discussed before, and the etch and rinse strategy can be suggested for use to improve the adhesion to the enamel surface. So self-etch and universal adhesive have a less acidic composition compared with phosphoric acid. Thus, there's always a chance that it will reduce the potential to demineralize the fully mineral phase of the enamel and eventually or consequently create or not create appropriate micro-retentive porosity. So that can be an issue uphand.
So Dr. Umer, which bonding system would you prefer?
Alright, so personally, if you ask me, and if I'm being cornered, I would prefer the universal bonding system via the selective etching. But as far as the science part is concerned or the evidence is concerned, if the protocols are followed correctly, I think all bonding systems, including self-etch or etch and rinse or universal, can be equally effective. Personally, I would prefer a universal bonding system via the selective etching.
What is ethanol wet bonding?
Alright, so let's begin with in understanding what is there within the adhesive system, right? So there is a water-rich zone which is very rich in polymerized or unpolymerized hydrophilic monomers along the resin-dentin interface that comes from the adhesive, and it's there present inside the hybrid layer, and that continues to be a problem. So even if the collagen matrix can be preserved, the loss of integrity through the degradation of the adhesive component will always remain. These polymerized and unpolymerized hydrophilic monomers present within the adhesive always are vulnerable for degradation. So in order to compensate that, ethanol wet bonding was introduced. It was to use ethanol as a solvent to dehydrate the demineralized dentin matrices and to assist the infiltration of more hydrophobic monomers inside the dentin. So once you have that infiltration of hydrophobic monomers, it tends to decrease the solubility, the water sorption, and the resin plasticization, and it may prevent or at least reduce the enzymatic hydrolysis of the collagen fibers. So because it's all about the preservation of the collagen fibers, so by ethanol wet bonding, you are inadvertently preserving the collagen. So together, these would lead to improved bonding durability. So, however, currently technique sensitivity and generally long treatment times prohibit ethanol wet bonding in clinical settings. So, and more user-friendly and reproducible techniques or materials need to be developed for everyday use. So, but still, ethanol wet bonding has its importance of its own.
Can dentine bonding using universal adhesive systems be made to last?
All right. Okay. Thank you for the question. So, like everything else, nothing lasts forever. But obviously, we are looking at the longevity of the filling material and the longevity of the bond strength of the universal adhesive system that you're using. So basically, the overall clinical success of composite restorations, it's actually multifactorial, and therefore it's very unlikely to be predicted by even a battery of in vitro test methods or different methods to evaluate it. So it's very difficult to predict. So there's only limited evidence. It exists to correlate the marginal quality and the bond strength in the laboratory with the clinical performance of bonded dental composites. However, it is clear that the rapid deterioration of dentin bonding does not improve the restoration longevity. We know that, right? So it is equally clear that it is possible to prevent or at least significantly slow down the rapid hybrid layer degradation, because the degradation is going to happen anyways. So we got to reduce that. So the carious dentin is not necessarily an ideal substrate for strong and durable hybrid layer formation. So obviously you're going to avoid that. You got to make sure that the soft infected caries dentin is removed and we've got more hard, glassy, or perhaps an affected dentine over there. And of course you can improve bonding by addition of a separate hydrophobic adhesive resin after the hydrophilic primer. It makes the interface more hydrophobic and it seals it more effectively, resulting in a more durable bond. And although the enamel bonded restoration margins, they cannot prevent the degradation, but we still need a proper sealing of the enamel margins, and that would result in a more favorable clinical outcome. So it's all about the margins also. We can also inhibit the collagenolalytic enzymes with compounds like clohexidine, and there's been a lot of work on quaternary ammonium silanes by my group, and that has come out with a lot of evidence for them to be used clinically in order to reduce the degradation of the collagen fibers through the collagenolalytic enzymes. Although clohexidine may not be perfect, and although long-term clinical performance studies are still lacking, there are no adverse effects with the use of that, and some manufacturers already recommend application of quaternary ammonium silane cavity cleansers as an optional step after acid etching. The techniques and materials that allow the use of hydrophobic adhesives offer another attractive alternative. Like I mentioned, the use of collagen cross linkers, and and in terms of following the right protocol, I think all of these would relate to improving the longevity of the restoration and the bonding. But obviously at this point of time, we cannot say that it's going to last forever.
Thank you, Dr. Umer, for this very insightful information towards understanding of the universal adhesive system. And I believe after this podcast, there will be a lot more students who will be using this system with a better understanding and comprehensive protocols.
Thank you for having me.
And thank you for tuning in to this episode of the Small Project Podcast. And don't forget to tune in to the next episode of the Dental Bites. Thank you.